Good evening. My name is Tommy Swate. I'm an attorney and also a physician. I would like to discuss with you today errors that are made when accused of irregular behavior. Irregular behavior accusations occur when you take the USMLE National Board Medical Exam and you're accused of conduct which they have labeled irregular. Many times students are caught up in this legal trap without knowing what happened. Like, you cannot seek, provide, or obtain unauthorized access to examining materials. Now, that's a strange one for me, because one of the things that I used to do I would want to find out what kind of questions they're going to ask me about anything. The board exams, when I took my OBGYN boards, I wanted to know what they were going to quiz me on. But anyway, they claim they're protecting their copyright by preventing people from asking other students what's on the test, or asking on the internet what's on the test. And apparently they actively supervise or check the internet for people asking questions. So you're at real risk if you go on the internet and ask somebody what's on the test, or what's been on the test, or what type of questions are on the test. Or worse, you go on the internet and tell someone else what's on the test. Other obvious transactions are providing false information. Of course, you know you're not going to do that if you listen to this tape. Taking a test or not taking a test, which you think you're not eligible for. You have to be in medical school, enrolled in medical school, in order to take the test. There's been one or two cases where the person wasn't enrolled in medical school but had a legitimate reason for wanting to take the test, and this person got tagged with irregular behavior. Of course, having someone take the examination for you, that's obvious. Taking notes of any kind while in the secure area of the test, failing to adhere to what the proctors tell you, and take that seriously. You have to do exactly what they tell you. Of course, altering or misrepresenting exam scores, those are obvious. Communicating or attempting to communicate about specific test items. Those are just some of the few transgressions that can get you accused of engaging in irregular behavior. Now, when you get a letter that claims that you have engaged in irregular behavior, some of the mistakes that I commonly see happen are first, you fail to get an attorney to answer the question. Secondly, you fail to get an attorney who is both knowledgeable about medicine and about law. Because somebody's been practicing law for 40 years doesn't make them an expert. Because somebody claims they're an expert doesn't make them an expert. And you do not want someone who doesn't know the difference between a proctoscope, or anoscope, and an otoscope, because they're liable to try to examine your nose with an anoscope. And you know that wouldn't work out very well. Don't think that you can call the National Board of Medical Examiners and explain to them your story. That is a big mistake. You may make admissions that will hurt you in the end. I tell everybody that I meet, and they get tired of me saying this, but a catfish wouldn't get caught if he didn't open his mouth. The best thing you can do is close your mouth, let your attorney represent you, because what the attorney says cannot be used against you, but what you say can be. Also, it's really important, preparation, preparation, preparation. That's the key to success before the board. There's no substitute for preparation, because contrary to what's argued by some lawyers, that because they're there and they're sitting there, that somehow that's going to really influence what happens, is totally untrue. Essentially, the lawyer at these meetings is a potted plant. They sit there and they don't say anything. What's going to make a difference is your preparation, your understanding of the procedure, your understanding and your lawyer's understanding of sometimes the medicine. You're going to be asked questions by the committee. Now, most of the time, those questions can be anticipated. And you can feel very comfortable because you're going to know how to answer those questions. Now, I can't say all questions are going to be anticipated, but the vast majority of them will be. And the other thing is you have to follow the procedure. You have to ask for a hearing. You have to go to Philadelphia. If, unfortunately, they find that you engaged in irregular behavior, there's procedures for appeal that are successful. Appeals can be successful, but I do not want you to take a bet that you can skip the most important part, making your initial presentation, and hope that if you don't succeed, you can go hire a lawyer and have the lawyer appeal. That strategy, I don't think, will be very successful. But anyway, if you receive a letter of irregular behavior, call me. I will talk to you the first time for free. My name is Tommy Swate. My phone number is 713-377-4860. My alternative number is 832-702-7599. Increase your chances of success by having both an attorney who is knowledgeable in the law and knowledgeable in the medicine defend you before the committee that's deciding whether you engaged in irregular behavior or not.